Hello, my name is Matt, and I'm giving a report about Rodney Davis. Mr. Davis is a 54-year-old African-American male who presented with chest pain that started at 16:55 and transferred to the emergency department at 17:25 after receiving 3 doses of nitro at home at 16:55 and 325 milligrams of aspirin at 17:15. There is a peripheral IV in place, and the patient reported allergies to penicillin, peanuts, and sulfa. Upon my initial assessment, I noticed the vital signs to be 98.4 degrees Fahrenheit, heart rate of 68, blood pressure of 124/72, respiratory rate of 12, oxygen saturation of 98% via room air, and a blood glucose was present of 118. Patient was alert and oriented ×3. Pupils were equal, round, reactive to light. The cardiac notations were a sinus rhythm with occasional PVCs. The patient reported subjective findings that reported that he felt short of breath and crushing pain in his chest. GI assessment shows he's voiding clear yellow urine without pain. Skin appears ashen. And the patient initially reported a pain of 8 out of 10 on a 0 to 10 pain scale. Mr. Davis also received a percutaneous transluminal coronary angioplasty, and there was a stent placement in the left anterior descending artery. He also received a chest x-ray, and the findings were no fluid or pneumothorax. Before the procedures were conducted, the disease-specific lab values found were elevated troponin T levels of 0.2 and troponin I of 0.06, potassium at 3.6, and creatinine at 0.08. So during the procedure, the percutaneous transluminal coronary angioplasty, Mr. Davis developed an anaphylactic reaction to the contrast dye, and potential shellfish allergy has been documented in his chart. Epinephrine was administered and a high flow oxygen via non-rebreather, and vital signs were reassessed after administration. Furthermore, Mr. Davis, he developed a hematoma at the puncture site, and we were able to apply pressure to the right groin site. Cardiogenic shock was evidenced through his reduced cardiac output and low blood pressure of 54, and agitation and restlessness and arterial blood pressure was noted of 88/54. Some medications were administered like norepinephrine and dobutamine in order to correct this problem. My recommendation would be to monitor for complications from this procedure and indications for potential infection. It is also important to note that I was able to educate Mr. Davis and his wife about coronary artery disease and making some nutritional decisions. That is the end of my report.